This meeting is being recorded.
Okay, at this point, what I'm going to do is I'm going to share my screen, make sure technology is working properly. Can everyone see the screen?
Yes.
Okay. This is my contact information, and as was stated earlier, I did leave Humana April of this year. I have to say it was a great place to work, and what they did, individuals with tenure, at least 10 years of experience, and I'm not going to say what age, at a certain age, they actually offered an opportunity to become an independent broker with their support. And to my clients, it's invisible. They gave me my entire book and they support me in all of my activities. So that is my new contact information. And they allowed me to keep the phone number, which I was ecstatic about. I couldn't keep the email, but I have the phone number. So my clients know that they can still reach me. You can email me. You can text me, you can go on Facebook or my webpage. So I wholeheartedly embrace technology. So a little bit about what I'm doing right now. First of all, I educate people on Medicare, and as a broker, I'm actually able to offer them other plans. I am contracted with 5 carriers, so whether I'm contracted with your particular plan, if you have questions about your Medicare plans and what's going on, feel free to reach out to me. I'm also involved with individual family plans, that's Cover California. And right now, if you don't have health insurance, the Cover California, just like Medicare, has a period during the year where you can enroll. And if you miss that period, then you're locked out until the following year. For Medicare, it's October 15th through December 7th. For Cover California, it's from November 1st to January 31st. And a lot of caregivers who have actually have to walk away from their employment, if they don't have Medicare, often they also lose their health insurance. So through Cover California, it takes in consideration your income and layer the premiums with state subsidies. So a lot of individuals in the past didn't feel that they can qualify for health insurance or they couldn't afford it. But now, with Cover California, they're able to get subsidies that make health insurance affordable for someone who is not covered by their employer. And that's up to age 64. What I'd like to talk about is a couple things today, about 5 different things. What are the changes to Social Security? What are the changes to Medi-Cal and Medicare? Social SSI versus SSA. I have the annual fact sheet, the Social Security fact sheet, and once again, making sure that you know how to gain access to your Social Security statement. And if there's a hand or question that I don't see, please feel free to let me know I have a question. Okay, so there's a couple changes that has occurred that will be occurring in Social Security. And one of the changes I'm certain everybody is familiar with. Beneficiaries will receive their largest raise in 41 years. So just as a question, how many of you are aware of that? And how much will the increase be? Any takers?
You have a taker.
Yes.
One.
The raise, I believe it's 8.7%.
Exactly, 8.7%. And that is a large amount, but when you take in consideration inflation, it's just barely enough to keep up with inflation. I give you an example. I was at Walmart the other day, and I'm one, I liked eating trail mix, try to stay healthy. So I bought a box of 8 trail mix. I went to the cash register. It was $9 for a box of 8 trail mix. Unbelievable. So imagine someone who's on Social Security and they are trying to make ends meet. This 8.7% is going to be small in comparison to what they actually need to survive. So on average, when you look at 8%, someone who earns $1,000, that is an additional $80 a month. So they said that the average increase is going to be equivalent to about $147.
Mhm.
The next increase would be higher earning workers will pay more to Social Security. So if you're not aware of it, Social Security is if you're employed by an employer, they pay a portion and you pay a portion. And that normally stops at a certain dollar amount. The average wage earner probably don't realize this, and they continue to pay Social Security throughout the year. But in 2022, if you made more than $147,000, when you hit that dollar amount, you no longer paid into Social Security. So someone who earned $200,000 a year, once they hit $147,000 for 2022, they actually received more take home because they were no longer paying into Social Security. So next year, those individuals who fall into that situation, they will continue to pay into Social Security until they hit $160,000, $200. So that is the way that they can increase the trust fund, the Social Security trust fund, if everyone continued to pay into Social Security regardless of what they made. But there is a threshold where those individuals stop paying into Social Security. The next change is the maximum Social Security payout will increase. So what that means is that I don't care how much you pay into Social Security, there is a maximum that Social Security will pay out. And Social Security take the highest 35 years of earnings to create what is called your PIA. That's personal insurance amount. That is what your monthly beneficiary amount will be. So next year, it is going to go from 33.45 this year to 36.27. So imagine having a Social Security amount that will go from 33.45 to 36.27. And normally individuals who have the higher amount in Social Security actually delay getting their Social Security. So you can become eligible for Social Security as early as 60 if you are a widow or widower, but on average it's 62 and above. So if you take it early, you will take that haircut and you will not see these larger dollars. It normally applies to someone who wait until their full retirement age, which is now anywhere from 66 to 67 years of age. Is there any questions before I continue?
Yes, so actually, if I'm understanding properly what you just shared, It does, irregardless to if you're a high earner or how much you've already paid in Social Security, there is a cap of what they're actually gonna pay you at the time of you retiring and eligible to receive your Social Security, correct?
That is correct. Absolutely. And I going to use myself as an example. I'm going to wait until my full retirement age. And the beauty of waiting is the fact that when your particular group get increases, you continue to get that increase as well. So those individuals who are delaying getting Social Security, the 8% also affects your base. It bounces you up as well.
Okay.
Yeah.
Well, I'm
So
50 right now, not that I need to really put my age out there. So, I'm 50 now, and so based on the year, and because they've increased, when you can actually get your Social Security, is there a possibility, not saying that you're all knowing, but is there a likelihood where they could possibly increase the age again as to when you can be eligible to receive your Social Security?
that is an excellent question. And the answer is yes. That has actually happened back in the 80s, because at one time, it's happened twice. At one time, the full retirement age was at 65. At that, and people would get their Medicare and their Social Security. So what they started doing is they noticed that there was less folks working, because at one time, the majority of the working population was the baby boomers. So when the baby boomers was working, you had like a 6-to-1 ratio. So 6 people working for every person that was collecting Social Security. But as the boomers start to age, that ratio started to decline. So you're looking at about a 4-to-1 ratio now. So what they decided to do is to extend the Social Security full retirement age. Each year they added 2 months to the retirement until it hit 67. Now, you may not be a news junkie, or maybe you're not politically active, but I encourage you to listen as to what the agenda will be going forward. You have a group that wants to protect Medicare and Social Security. You have another group that want to look at it and implement cuts. And one of the cuts that has been suggested is to actually raise the full retirement age to 70. So if you were a Gen X, Gen Z, well, you might be working a little longer than some of the boomers because of what is being proposed or in discussions at this time. And in order for something to become legislation, discussions take place early on.
Yes.
So don't go to sleep on this. You got to stay very mindful about what's going to happen. The next change will be withholding thresholds for early filers are increasing. So what that means is, I often hear people say, well, at 62, I'm going to get what's due. In the back of my mind, I normally say, you might not want to think like that, because there are some negative aspects of collecting your Social Security before your full retirement age. The biggest drawback is that if you start collecting Social Security, you have what they call earning limitations. You cannot earn as much as you typically would without having to pay a penalty back to Social Security. So, for instance, this year, you're looking at $19,560 that you can earn without having to pay penalty. and that's going up to $21,240. So let's say, for instance, someone who earned $45,000 a year, and they're collecting their Social Security. So once their year-to-date earnings hit $21,240, it becomes a disincentive because you're going to pay $2 in taxes for every $1 that you make. So be very careful about that. Now, if you find yourself in that situation, you can do what they call, you can suspend your Social Security benefits. You can suspend them at any time. But in order for you to do a do-over, you have to suspend it and pay back the money that you've had within the first 12 months. In this case, you would just suspend it. And then when you elect to have it again, your amount that you receive might be more. Why would it might be more? Is because if you're earning and the earnings that you're making is higher than the previous 35 years, then they will recalculate what your payout would be, but it will never be at the full retirement amount. Okay.
Wow. Okay, that's interesting.
Disabled income thresholds are also climbing. So if you're disabled, they're also going to be receiving an increase. And it's very unfortunate that if you're disabled and you're on Social Security, which I'm going to talk about a little later, it is basically the supplemental that you're receiving, and it's SSI versus SSA, and everyone in that category is also getting an increase. In order to be eligible for Social Security, you might hear about my quarters. You know, you have to have 40 quarters to be eligible for Social Security. And what has happened in the past, the quarterly credits have actually increased. So let's say, for instance, I'm a part-time worker and maybe I only worked a couple hours and I earned $3,000 for this year. I'm not going to get 44 quarters for this year. Each quarter has its own set of values. So to get one quarter, you have to earn $1,510. So if I only worked only earned $3,000, I'm only going to get 2 credits for that year. So next year, in order to get 1 credit, it is now going to be $1,640. And to get 4 credits, you have to earn $6,560. So what does that mean? You have, if you go into Walmart or you go into McDonald's, sometimes you see seniors acting as greeters, or they're busting tables. Many of them find themselves short on quarters. So they're trying to earn enough quarters to get their entitlements. 1 quarter will stop the show. They do not give, there is no forgiveness on being short on quarters. Also, and lastly, the tax liability will increase. A certain portion of Social Security is taxed, and it's taxed as an individual, and it's also taxed as a married couple. So to think that, you know, I'm getting Social Security and I'm escaping my taxes, not going to happen. The sad thing is, and a lot of people say that it's like double taxation, because when you work, that money was taxed. Now that when you take it out, the money's being taxed again. So I don't think that complaint is going to ever move in the direction that we'd like to see it, because the whole economy revolves around taxes. Okay, so there's some changes that has taken place with Medicare that I'd also like to share with you. Now, one of the biggest changes that has occurred with Medicare is the way people like myself market. Last year, you probably received all kinds of telemarketing calls saying, you know, we can verify your Medicare, we can review your Medicare plans. It was all over the TV. We had Jimmy Walker talking about call now.
Yes,
It it
yes,
it it was just terrible. And
yes,
what
it
took
was.
place is that a lot of people, especially seniors, they don't have a lot of people they engage with. So someone calls them, heck, I'm going to talk. I got somebody on the phone. What do you need? Yeah, whatever you want. Let's keep the conversation going. Well, those conversations went in directions that they should never have gone. Many of those seniors had no idea that they were re-enrolling in plans where they didn't have access to their care teams, and Medicare got involved. In fact, Medicare said that the complaints level went up 40%. So what did they do? Well, they made it harder for people like myself and others who follow the rules. So if you receive a call and someone is talking about Medicare today, this is what you want to ask them. Is this call being recorded? Every call that I make, I have a special number that I have to let the person know that's going to show up, and the announcement goes, this call is being recorded. So every Medicare call, especially with an enrollment or any plan discussion, now has to be recorded. And I've still had a few random calls to come into my cell phone, and the first thing I, so is this call being recorded? Guess what? Bloop.
Okay, good.
Okay, so now you know that if that happens, they are in violation of CMS, which is the Center for Medicare and Medicaid Services. The other change that has taken place, if you're on Medicare this year and you're paying for your Part B, on average, it's $170.10. It's
Mhm.
going down by $5. So it's going to be about $165 next year, $5 difference. That's typically, it never goes in reverse, but what happened is they overcharged all of the beneficiaries last year because of the new Alzheimer drug that really didn't materialize. So with the 6% raise last year, between a 5 and 6% Social Security raise, most of that raise went to pay for the increase in Part B. It went from 143 to 170. That was a huge jump. And most folks only enjoyed about a $20 increase in their Social Security. So
Right.
this year, the 8.7% will have a greater impact because it's going down by $5 instead of going up. Usually when a beneficiary receives an increase in Social Security, their Part B also goes up. Any questions before I move?
Yes. Varnessa Sharon, would you please make sure we get your contact information, your cards and some literature, please?
Absolutely, absolutely. I hate to say it, I had a little goodie bag and all that packed, but I'll make sure that you get that goodie bag with my cards and stuff.
But you know what? We're gonna be here till 3:30 today, if you can make it. Come
I
on
will.
back.
I am. As I would say, I'm gonna make it.
Okay.
All right.
Thank you.
I do have several other questions, but I don't want to eat up our time. So I have, my father is, I ended up having to put him in a convalescent home, but I just found out that the convalescent home just applied for them to be the payee for his Social Security to come directly to them. They never notified me. They never reached out or sent any type of, they never called me. They never sent me an email or any physical mail to indicate that that was a request for his shared costs that he needed to pay.
Yeah.
So now I am foraging and quickly trying to make appointments at the Social Security office. I was told several different things so that I can be the payee to be able to not allow that to happen. And then my other question also has to do with Medi-Cal. My mom is older and she has not been diagnosed with dementia or Alzheimer's, but me already having gone through with my dad, she is exhibiting some of those characteristics. So I have been actively trying to very gently be the plan coordinator and field trip coordinator to try to help her stimulate. But what I've been encountering, she will not allow me to go to the doctor with her, but she has Medi-Cal and to get the providers. She also has diabetes as well too, but I'm just like trying to help get the best suitable care for my mom as well. So those are like more in-depth questions that have a whole bunch of caveats to it. So I would definitely reach out to you for a one-on-one if that's possible.
It's so, your question was so timely because you noticed the next card that I had in the slide.
Yes, ma'am.
That is the Medi-Cal card. And the Medi-Cal card is given to individuals who meet certain criteria and have low income. Now, often, and I tell people, just go ahead and apply for Medi-Cal and see what they say, what your share of cost is. And the share of cost for some individuals is very high because their income is over a certain dollar amount. But what comes into play, that share of cost is important when you look at in-home supportive services and long-term care. If they're placed in an assisted living environment, I don't know your particular situation, but if both of your parents have Medi-Cal, okay, and they place them in a long-term care or assisted living environment, what takes place is that they're going to pay their share of costs first. So let's say, for instance, their share of cost is $800. So they take that share of cost out, and then Medi-Cal pays for the rest of whatever the cost of staying in that facility. If the share of cost is even higher than that, they will take the Social Security check. They will become the representative payee, and they may give the beneficiary maybe, I think they have to give them $20, at least $20 out of that. And then they keep the rest of it because their justification is that they're providing room, board, and care.
Yes, okay, so my dad, so this is for my dad who's in the convalescent home. I had to move him from a previous one. And so his shared cost was close to $500.
Yep.
However, because it's not an assisted living, he's there because he has incontinence, he has difficulty walking and that whole thing. So he does need around the care help assistance. But we knew that the shared cost, when I found another convalescent home because of other issues, which we'll talk about later, the new convalescent home, when I signed the paperwork, put in everything, they never said, okay, now that he's here, and he has been here for a month, this is his shared cost. Please provide, they never provided me the invoice like they did at the previous convalescent home. They just automatically jumped to putting in an application to Social Security to be the payee. So now I'm trying to circumvent that because that's not necessary.
Yeah, you're going to have it's going to be difficult, and I'll tell you why, because sometimes when you admit individuals into those facilities, they give you a lot of paperwork, and the paperwork says that. But because it's just overwhelming and you want to just put all that behind you, you don't read the fine print, but they've disclosed it.
In this instance, I don't think they did. My regular job requires me to read in depth specifically for, things like that, and it was not indicated in there.
Yeah, but like I said, if you're having problems in that situation, you want to find out what your options are. Their caseworker needs to get involved, but normally what happens is they will take the check because they're providing the room and board.
They're gonna take the money.
Yeah,
Yeah.
they're going to do that. And there's some changes that has occurred with Medi-Cal as well. One change is that at one time, if you were an undocumented resident, you couldn't get Medi-Cal only for emergency purposes. As of July of this year, you don't have to be documented to get Medi-Cal. The second change that has occurred is that they used to have an asset test. If you had X number of dollars, you could not get Medi-Cal. So case in point, you have a lot of people who have a very low income at this time, but they might have a 401k that has, let's say, $100,000 in there. That used to disqualify them from getting Medi-Cal. Now they can have up to $130,000 in a 401k, in IRA, because that money is designated to help them live for the rest of their life. So they're no longer going to be penalized for having those types of assets. So they've been able to enroll more people into Medi-Cal because of that relaxation. I met with a lot of people say, well, I have this small CD that I've been, I roll around and I might just take a little bit off of it when I need to have it. That has been a disadvantage for them in getting Medi-Cal. So that changed as of July of this year.
Mhm.
Okay, and I know I went through this last year, but I always like to refresh people about Social Security versus SSI. Okay, there is a difference. They come from a different pot of money. So when you hear someone says, I have Social Security and I have Medicare, I have Medi-Cal, when I meet with them, the first thing I ask them is, let me see whatever card you use for healthcare purposes. When someone has SSI, that means that they did not earn their 40 quarters. They are receiving income from a different pot of money. It's actually coming from the taxpayers. It's not coming from the Social Security Trust Fund. In most folks who receive SSI are disabled, they're blind, and often it's from birth. Or once they turn 65 and they're not eligible for Social Security, they receive SSI. When you just receive SSI and you have Medicare, you only have Part B, as in boy, you do not have Part A. When I see that, that tells me that this person did not work 40 quarters in a lifetime, and they only have B. B is for doctor visits. So Medi-Cal provides them with inpatient care. So if they have to be placed in a hospital, they're normally designated hospitals that will accept Medi-Cal. They don't have the same choices as someone who have Social Security. Social Security means that you've paid into the system at least a number of years to qualify for SSDI or through retirement, Social Security, which is considered SSA versus SSI. And this is confusing for some people, especially older people who say that I'm on Social Security, and you look at their benefits and you say, oh, this is SSI and not SSA, With SSA, you're entitled to Medicare Parts A and Part B, either through a disability or through age. That gives you a lot more flexibility than for someone who just have SSI with Part B and Medi-Cal. Any questions about that?
Oh,
So I
I'm
just,
oh,
as caregivers, you want to make sure that you understand if you're helping someone make their healthcare decisions, what pot of money that they're receiving benefits off of, because it is different. They will still receive the increases, but their increases is based upon a smaller amount. So if you have a child who has a disability and becomes an adult, they often have SSI. They
I
would,
have a question. I'm
ahead.
sorry, I have a question.
Yes,
How many years is 40 quarters?
it's 10 consecutive years of employment or throughout a lifetime.
Okay,
Yeah,
thank you.
yes. And there, that seems a given, but here's where it could shift. If someone is self-employed, you have a lot of successful self-employed people, you look at your realtors, you look at your tax preparers, just to name a few. These individuals are self-employed. You take in all of this cash money. If you don't pay self-employment taxes, you don't get Social Security. So I always tell self-employed people, I know it hurts to pay self-employment taxes, because when you pay self-employment taxes, you pay what your portion and what the employer would have paid. So instead of paying 7.6% for your Social Security, and then another 1.24 for Medicare, you pay both of that. So, when you're rolling in the dough when it's cash, I don't know, I don't want to give up this money. But what I've seen, and I have conversations with people who have run successful businesses, and all of a sudden I see them have SSI, a Medicare card with just Part B. You have to ask, did you pay? I didn't pay self-employment taxes. So it does hunt you, but at least pay the minimum where you can receive these benefits. And that, and it's difficult, I'm paying these taxes. But as a self-employed person, you get to claim on your tax returns the portion that your employer would have paid. So you get half of it back. But it's a matter of that you got to pay taxes to get the entitlements.
Okay, I have a question. When is the best time to apply for Medicare? 64 and a half?
You have to apply for Medicare. First of all, you have to be entitled to it. And it's a 7-month period. It's 3 months before your 65th birthday, the month of, and then 3 months after that. Now, I get this question all the time. Well, what if I'm working and I have coverage through my employer? Do I need to apply? The answer is no. As long as you have coverage and it has a prescription drug plan that is comparable to what you would receive in Medicare, you do not have to apply. A lot of people, when they turn 65, they apply for Part A. That way they get the card and they have their number. So when they decide to retire from their employer, what they would do then is just apply for their Part B, because Part B is what costs you. When you pay into the system for 40 quarters, you're paying for your A. And A is actually more expensive than B when you start to receive that benefit. So they get their A, they paid for it. And when they get ready to retire, what they do is they go to Social Security and says, I want to initiate my Part B benefit. But because it's past their 65th birthday, What they have to do is to make contact with their employer. The employer have to complete an additional document saying that they had coverage with the employer from the time they turn 65 to the time that they retire. If they don't produce this document, Social Security will impose a late enrollment penalty. Okay.
Mhm. And can you explain the difference between Part A and Part B?
Okay. Part A takes care of you when you're in the hospital for basically inpatient stays like hospital, skilled nursing, and hospice all come from Part A. Your Part B is anything outside of a confinement. That would be to see your primary care doctor, any type of treatments like chemo, radiation, physical therapy, that all comes from your B.
Thank you.
Okay.
What is the late enrollment penalty like? Does that go back to like years, or how does that work?
Well, there's two penalties. Is the Part B penalty, and the Part B penalty goes for it's twice the amount of time that you didn't have it. So let's say, for instance, you turned 65 and you decided that you're going to participate at age 67, and you didn't have any coverage for 2 years. So you're looking at a Part B penalty of about 4 years, and then you have your Part D as in dog penalty. That's your Part D. So interestingly, your Part B as in boy penalty is tied to, let's say, for instance, the Part B penalty premium for next year is going to be $165. Well, if you were late enrolling, you might be paying $200 because Medicare don't play. They said, you're going to come to the party late, you're going to pay. So you're going to pay, they just attach it right to, and they take it out of your Social Security. Okay. Now, your Part D, if you decided that you wasn't going to get a prescription drug plan, maybe you got Medicare, and you say, I don't take any drugs, I'm not going to get the prescription drug plan. I'm just going to carry the red, white, and blue card because I don't go to the doctor, I don't take meds, I'm good. I just got this. So you're paying for your Part B premium from Social Security, and that's fine. But all of a sudden you become ill and the doctor prescribes medication. He says, well, you can get it off your Part D. And you says, I don't have a Part D. I never had a Part D because I didn't take prescription drugs. That's a bad answer, because what's going to happen when you can only apply for Part D when you become eligible during your initial enrollment period and during periods like this. So you enroll in a prescription drug plan, it becomes effective as of January 1st of the following year. So you've been 2 years without a prescription drug plan. The penalty will be assessed. So it's roughly 33 cents a month for every month you didn't have your prescription drug plan. So that starts to add up. I have, and it's a relative, one thing folks don't talk about is their health and their wealth amongst one another. Now, those are taboo subjects. You don't talk health, you don't talk wealth. Well, I think this cousin should have talked a little bit about health, because when I met with her, the Part D came into effect 2006. This was an initiative by the Republican Party. They found out that Medicare could increase their war chest by requiring everyone to have a prescription drug plan. So in 2006, January of 2006, every beneficiary had to have a prescription drug plan. If you get a Medicare Advantage plan, it's already included, taken care of. But if you chose not to, and you just wanted to use the original Medicare card, you had to have a Part D. So a lot of folks, somehow they just slept through that particular requirement. So if they were on Medicare 2006 going forward, they had to have Part D. Well, some folks kind of slept through it, and when they realized they had to have it, or when they enrolled in the Medicare Advantage plan, Medicare told the individual plans, this person owes us for these number of months that they didn't have it. I've seen some penalties as high as $30 a month, and that's for life. The only way it goes away is if they are now eligible for some type of entitlement, like what they call extra help, Medicare savings, or Medi-Cal. That wipes it out. But otherwise, it's a cross you're going to have to carry for the rest of your life when you don't get your Part D when you should.
Ms. Varnessa, we have a question in the chat. Can you hear me?
Yes.
It
Let-
says, when you receive an invoice for Medicare premiums 3 months in advance, do you have to pay it all at once, or can you break it out and pay monthly?
You're supposed to pay it at once, but what you want to do is, because it is a hefty bill. This year it's like $510. So what you might want to do is to contact Medicare or Social Security to see if you can pay monthly as opposed to quarterly. It all adds up the same, but it's really eye-opening when you see the $510. Whereas if you pay $170 a month, it's the same. They don't tack on any interest on there, but yeah. Or either discipline yourself and just pay it monthly.
I have a question. I had Social Security disability, and I had the Medicare, the Part A or whatever, but I never took it because I was always under my husband's benefit.
Mm-hmm.
And so even now I'm still under my husband's benefit. Do I have to pay anything, any kind of penalty as a result of not using it, taking it?
Okay, that's a very interesting question. When you receive Social Security disability, you normally receive it before the age of 65. So when you were approved for SSDI, around about the 24th month, you get this red, white, and blue card in the mail. A lot of folks don't understand why I got this card. They just say, oh, whatever. So they do nothing with it. And so there is a penalty, because if you're associated, but a lot of people say, well, I have coverage through another source, so I'm going to turn it back. I don't want it. Because with SSDI, you actually get 2 bites at the apple. When you turn 65, you get another initial enrollment period. But if you have coverage through your husband's employment, you don't have to get it.
Okay, because I remember them asking me for proof of like having coverage, and I remember sending that to them, but I never did anything with it, and I still have his coverage, and I've never used the Medicare.
Yeah.
So I don't have to pay any penalties or anything?
No, because you can show where you've had coverage.
Okay, thank you.
Yeah.
We have another hand up, Ms. Foley.
Yes, thank you. I have a question, and I'm not sure if it fits in here, but my husband, can you hear me?
Yes.
Oh, okay. I'm concerned that my Medicare and medical coverage, all of that is based around my employment. My retirement, I have like a package, and all this. We have Medicare, we have like an Advantage program. If I die before my husband does, my coverage that's part of my retirement package from my job cease to exist for my husband. What I would need to know is, are there things that I should have in terms of a contingency plan, so that if this happens and my husband is no longer covered under this package, do we have to reapply?
Okay, that's an excellent question, and I see that happens all the time. A lot of this is typical with federal, state, county, private pensions, PERS, where they give the spouse the same benefits as they give the actual retiree.
Yes.
But if that should happen, they would be eligible for what they call a special enrollment period. So my question is, as an individual, does your husband have 40 quarters into
Yes.
Social Security. Okay,
Yes.
so with that, what he would have to do is he would have a special enrollment period. He would contact Social Security saying that he needs to initiate his Medicare benefits as an individual. So if he doesn't have Medicare, he can apply for it at that time. He will be waived from the penalties because he had coverage through your employer. Your employer would have to provide the documentation where he was covered. But if nothing else, have him apply for Part A now. A doesn't cost him anything. He can just get his A.
So separate from what we have as a package, you know, we have everything, A, B, we have all of that.
Oh, if he have all of that, then the only thing he would do is leave the group, because you're part of a group retirement. He would then just go on as an individual, and he would find a Medicare Advantage plan. But there's no penalty there.
Okay, so I'm trying to think, because my husband's you know, with the he has the dementia issue, and I'm trying to do what I can in the event that I die before my husband. Is there anything that I can do now to like prepare in the event he's faced with this situation? Is there anything I can do now?
Well, if you want to remove him from your group and place him on his own individual policy, you can do that now. Do you have power of attorney for him?
I do, but he has very good coverage with me. Would he be eligible for the same coverage?
You would have to talk to the employer. You'd contact your HR to find out if your spouse would be able to continue in the group plan, because a lot of employers allow that to take place. They don't remove the spouse who's receiving the benefit.
Okay.
Yeah, my husband just passed away and he had CalPERS and he had his where my coverage continues and
Yes.
they send me a thing from Cobra, but she said as soon as I do the application that it will be reinstated.
Right.
Right now, it's interrupted.
Right.
So my coverage continues and maybe you can do that.
Oh, okay. Because
That's why it's important to look at, and often,
we're CalPERS.
yeah, and that's why a lot of especially civil servants, when they leave employment, they have debriefings on benefits so that they can understand what the contingencies are in case something happens. So I would encourage you to look at that separation packet, whatever you had when you retired. It should be in the fine print.
I think there's some mention of a COBA, you know, a period. I just want to try to do as much as I can in the event that I should die before he does, just thinking about his medical coverage in the condition that he's in.
But if you're in CalPERS or something that has a large population,
yes,
it should have some sort of succession planning in there where they don't just toss the spouse out. But I have seen in some more private pension plans that has a shrinking pool that the surviving spouse, the non-retiree, have to find their own plan, or they're terminating the plan. I see a lot of that going on when, you know, back in the day, they used to give, you know, great retirement packages where they had medical for life. Well, they're no longer able to sustain those benefits to the point now where a lot of folks are having to leave those nice plans and they look for Medicare Advantage plans to get as much as they had in these packages.
yes. I know we're very vulnerable as we get older, and if everybody doesn't know, like I'm the primary for that insurance, it's very easy for the person living to miss dates or numbers or anything. So I will be looking into that so that I clearly understand it and have it written someplace.
Absolutely. And the other thing that I caution you, when you retire, often there's documents that you have to look at. You want to look at if you have 401ks, if you're rolling over annuities, those type of things. You want to look at the fine print, because especially if it's a husband and wife situation, depending upon what box you check, you can actually eliminate future benefits from your spouse. So be very careful about what boxes you check, because once you check the box and they make the first payout, there's nothing, the contract is in force. So be very careful about that.
We're good on that. I'm not clear on the medical.
Yeah.
I just want to just be the best advocate for him if he needs me to be.
Yeah.
Thank you very much. That was very helpful.
You're very welcome.
Ms. Varnessa, we have another question in the chat. It says, if you don't want a Part C plan, is there a way to receive dental benefits through Medicare?
Okay, so if you don't have a Medicare Advantage plan, is there another way that you can get dental?
If you don't want a Part C.
Yes.
Yeah.
Okay, it will not come from Medicare. It will be from in the market. And there are standalone dental plans. And if you're interested, not a shameless plug, I can provide you with some of the options, but I can tell you they're not going to be as great, unfortunately. And once again, this is some of the discussions that took place over a year ago with Bernie Sanders. He wanted to have dental and hearing placed with Medicare. And it hasn't happened. And probably because the insurance companies is killing it because it would kill the advantage that they have right now. But there are standalone, there's Delta Dental, there's a lot of standalone dental plans, but unfortunately, when it comes to insurance, dental insurance, I think is probably the worst in coverage because you're going to have some skin in the game regardless of what they do. There's high deductibles and there's maximum coverage. Most dental plans peak at between $1,500 and $2,000. So if you have a crown and a root canal, well, that was a drop in the bucket. And you have co-pays. Co-pays sometimes as high as 70%, 50%, but there are plans out there. Okay, this is a fact sheet and I can send this electronically to the group because I think this is really interesting as you look at the 2023 Social Security changes. It just kind of puts it into perspective. And what we're having right now is called a COLA, which is a cost of living adjustment. So the first box referenced the tax rate. So employees pay 7.65%. A self-employed person pays 15.30%. And this is why they say they don't want to play. 15% of my earnings is going to taxes. Well, you know, I'll go underground first. But it is huge. And the same, that rate has not changed for 2023. Maximum tax rate. Remember, I shared with you people who earn large dollars amount. After they pay a certain dollar amount, they no longer pay in a Social Security. So for 2022 is $147,000. For 2023, $160,200. So this is how, as I said before, we can close the gap on the trust fund. The quarterly coverage, it went from $1,510 to $1,640. So someone who's working at a McDonald's, Target, Walmart, you have to earn that dollar amount quarterly to get 1 point. And you multiply that time 4, and that's what you need to get 4 quarters, your 4 quarters for that year. The most you're going to get in any year is 4 quarters. Now, the reason why they set at 40 quarters, let's face it, ladies, sometimes when we have kids, we want to be there for our family. So a lot of women actually dropped out of the workforce for several years, and then they rejoin the workforce. And when they drop out, they may be, you know, short of their 40 quarters. They might only have even maybe half of that. So when they go back, they'll pick it up. So it's through the lifetime of work. And looking at retirement test exempt amount. So This has to do with someone who's collecting their Social Security before their full retirement age. So this year you can earn up to $19,560 before you start to be penalized. Next year it goes up to $21,240. So if you know someone that's about to hit that age of 62 and they says, I'm going to go get mine, let them know that if you get this and you continue to work, you're going to pay more in taxes than the benefit that you'd like to see. But once you hit your full retirement age, this is no longer a factor. And sometimes people are a little confused that once they collect Social Security, they could no longer work. Well, once you hit your full retirement age, you can continue to work. You can get your Social Security. You can continue to work. You can have, I mean, if you want to collect as much as you can do that with no penalty. It's just if you do it before your full retirement age.
If you continue to work after that, do you still pay into Social Security?
Yes, you still do. They don't waive that. Oh, no, they don't waive that. It's just, there is no breaks with Social Security.
Miss Varnessa, it's Kim.
Yes.
Kind of off topic, but on topic. Just wondering how many more slides you have.
Oh, I have about 3 or 4 more, not many more.
Okay, so maybe we can go ahead and go through those slides and hold the questions, just because there's so much planned for today and we're so excited, but we have to move it along just a little bit.
Well, the next set of this particular slide is just additional information, but what I wanted to convey was on the front side of this slide. But anyone who wants a copy of this slide, I can send it to the group electronically because it's a good tool to have.
Please do. If you could forward it over to us and we'll get it out to the entire group.
Great.
And if there's still anything pertinent to say to the slide so that they know what they're getting when they get it, go ahead and say that. Yeah.
Yes, I will. Now, this is just for educational purposes. And I know every year I close with this recommendation. If you have not gone on to mysocialsecurity.gov and enroll to at least have a presence there, you are exposing yourself for identity theft. What does that mean? If you don't do this and someone gets a hold of your Social Security card, know your date of birth, guess what? They are now you in all of your business. So it's important that you do this. So this is what it looks like when you start to set up an account. Okay, and once you set up the account, this is what you're looking for. This is your journey home. As you work and you pay into Social Security, this document changed about a year ago. When I pulled it up again, I said, what? This is not what I'm used to seeing. So it is a lot. That particular site is very informative because I guess Social Security wants you out of the office. They're going to put as much out there accessible to you that you can get as much information. So what this is showing that this particular employee, they're paying into the system. They're looking at maybe collecting at age 62. That's $1,465. Their full retirement age is 67. That's $2,119. Do you see the big difference? That person will take a 30% hit. Plus, they have earnings limitations. But throughout those years, you can see where it will tell them what they would earn at certain intervals. Now, if they roll the dice and decide that they're going to have a contest with Social Security and they want to get their 8% bump for every year that they delay after their full retirement age, which is 70, they will get $2,634. So Social Security says, if you allow me to have your money and you delay collecting after your full retirement age, I'll pay you 8% every year that you delay it, and you'll get this whopping amount at age 70. Well, you have to look at what's the longevity of your family and what's the condition of your health. Because if you're not in good health, you might want to collect it at 62. That might be a good deal for you. Or if you're still able to work and you want to delay collecting it, you can do it. The one thing about Social Security, it is not like a 401k or a CD where you can assign a beneficiary. The only individuals that can benefit from your Social Security is a spouse or a disabled child. Other than that, I cannot will my Social Security. Social Security bet that we all die before we collect. I hate to tell you that because then they win. But if you stick around like some folks, you're talking about the octogenarians, they're 100 years old. Social Security don't like that because they're paying out more in some cases than some folks paid into the system. And if you want to take a look at your annual earnings, it's there. It tells you if you are on track to receive your Medicare. It tells you how much you paid into the system and how much your employer paid. And that concludes the presentation. This is my contact information. I'd be more than happy to meet with any of you to discuss your particular situation. And my services are without a fee.